Doctors have read it. What was the worst thing you've seen for a patient that another doctor overlooked? Broken neck. No, really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asked when he broke his neck. He had a brand new unstable neck fracture. Checking his initial x-ray, we see that it was there prior to the operation. After questioning the patient, he said that on his way to the hospital, the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately, he passed away about 2 weeks later due to the cancer. Story 2. Patient was lactating, but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. Story 3. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist since our experience was so negative. Next, derm immediately diagnosed what turned out to be a sarcoma, which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal. I now have months of experience with wound drains, tunneling, bandages, triage, and the laundry that comes with massive wound healing. Story 4. I suppose I have one for this as a resident doctor. We saw a kid in the emerge for difficulty walking. He had been slowly losing the ability to walk over months and also had random, unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran, etc. Turns out on exam, he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me, and I'm not even good at this yet. Did a CT scan. Big-ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain, and he went to ICU. My supervisor got pretty emotional about it, actually. Story 5. My best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain and her doctor said her ribs must be fractured. Long story short, it wasn't fractured ribs. At some point when the pain became too much to bear, she went to the ear and got a key. Turns out she had stage 4 incurable disease. She passed a few months later. She'd been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy, she'd probably still be alive. Story 6. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior, and the urgent care didn't do any x-rays. Told her she had a sprain and gave her a walking boot. She lost her foot. Story 7. MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point, the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Story 8. Young student. He was complaining about his neck feeling stiff. He went to a doctor some days before, and he was told he was having joint pains that would pass with some common anti-inflammatory medics. When I visited him, I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness. And not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinal mass, suggestive of lymphoma. Sadly, I don't know what happened to him. Story 9. Once when I was a medical student on surgery rotation and trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kind of yellow. So as part of our trauma workup, given that he couldn't give a great story, and we couldn't be sure what happened, we scanned his abdomen and saw his common bile duct was like 3 times normal size. About that time, next set of vitals, his temp was 103. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. Story 10. There was a story pretty recently in the hospital I work for, where a cardiologist in the ER was doing a rather difficult night shift and started feeling lightheaded, dizzy, and fatigued. Given how intense those shifts are, 26 hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He passed for several hours by the time someone realized something wasn't right. Story 11. One that comes to mind is when I was a resident. The ed doctor wanted to admit a mild septic patient. I review her labs, and knowing that she's a diabetic, it was obvious florid diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive IV fluid rehydration. She was just in the ed hallway with no medications at all, looking like crap. Story 12. Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, "So, how long have you had multiple sclerosis?" That was the first she was diagnosed. She had been battling various multiple sclerosis symptoms for a couple of decades without a diagnosis. Story 13. Speaking as a patient. When I was a kid, my eyes were hurting, and my dad kept taking me back to the same eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals to wash them in. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, after a year, my mom forced my dad to take me to a different doctor. Literally, he met me in the waiting room, looked at me with his naked eye and said, "You have a raging eye infection." A month of medicine, and the infection was gone. But there was so much scarring and damage, it was 20 years before I could wear contacts again. Story 14. In residency, I saw a cardiologist miss a STEMI, heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died, and he was in cardiogenic shock. Basically, his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily, he made it through, though. Story 15. Not a doctor, but actually the patient. I had a doctor prescribe me birth control. While in line to pay for it, I'm reading the paperwork that comes with it and learn that another medication I am on, permanently and every day, completely voids out any effect the BC would have. I went back to the pharmacist and asked about interactions, and he says I may have side effects. I ask which ones, and he says pregnancy. Pregnancy is not a side effect. It is a lifelong commitment. Then I call the doctor and ask why they would prescribe something they knew wouldn't work, and she said, "But you asked for BC." Like, yeah, I did, but I wanted some that would work. Silly me for not specifying. Story 16. Neurologist sent patient to our ed without informing her that imaging showed a glioblastoma, assuring her impending pass. He didn't overlook the disease. He overlooked the communication. Story 17. I'm not a doctor. I'm a nurse, but not in med-surg. My sister had her gallbladder out, routine surgery, and 2 days later woke up at 4 a.m. in searing pain, went to the ER by ambulance. I met her there. The ER docs were all apparently convinced she was a substance and did not even conduct a physical exam beyond taking her vitals. They snowed her to shut her up because she was just yelling, "Help me! Help me! I'm dying!" They did eventually do an MRI, but said it was negative and sent her home. She didn't want to leave, insisted something was terribly wrong, but they said they would call security and have her thrown out. At this point, I'd like to mention that she had no history of substances or alcohol abuse. She continued to get worse at home and the next day went to a different hospital. They did a workup and found that the metal clip that closed off the bile duct had cut right through the tissue, and she had a large bile leak that was literally hit all her abdominal organs. She had to have 3 surgeries to fix it and was hospitalized for 9 days, left with chronic pain from adhesions and chemical burns. When the new hospital finally acquired the MRI from the original ER visit, she was told that the leak was small but clearly visible in that image. Story 18. Patient getting anxious about numbness in his hand. It's getting more frequent, and I don't want to live like this. It gets me freaked out like my hand's not there. They assumed the person having symptoms of panic attack. Elevated breathing rate, tingling, numbness in hands. They did a CT because I requested it. There was a lesion. They blew it off. MRE showed it was glioblastoma multiforme. It was missed by the ER physician assistant. The MD supervising them never spoke to me, not even sure if they reviewed the case. Story 19. E-med student here. A patient came to the otorhinolaryngology outpatient department with complaints of sudden hearing loss. He had visited his physician the previous night, who did a routine examination of the tympanic membrane to check for perforations and brushed it off, saying it's nothing severe and gave him some antihistamines for his cold, as he suspected a block in the eustachian tube to be the cause. Next morning, he noticed his hearing loss has not reduced and had actually worsened. He came to us with this same complaint, but only except we noticed that the patient was afraid of walking without support, as he had imbalance and vertigo. We quickly did tuning fork tests and found that he had sensorineural hearing loss, and suspected of inner ear diseases, we ordered a CT scan in which we diagnosed vestibular schwannoma, acoustic neuroma, which had invaded the CP angle. It's a benign tumor of the inner ear, and we promptly referred the patient to a Gov-funded hospital for further treatment according to the patient's wish, as he didn't have enough money to undergo surgery in our privately run hospital. Story 20. Not a doctor, but the patient. When I was born, I was my dad's 3rd child. 2 from a previous marriage. He knew something was wrong with me because of the way I was breathing, very rapid, short breaths. When I was 3 months old, they noticed there really wasn't a change. The first hospital he and my mom took me to, they said that there was nothing to worry about, and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital, and they said there's definitely something wrong, but they didn't have the technology to help. 1986. They recommended us to a third hospital, which was a couple hours away. Finally, the third hospital took me right in and performed surgery that day. I'm doing wonderfully medically today, and am forever in their debt. Story 21. Ooh, I've got a good one, albeit sad. I was working nights, and a patient came in for a nail bed repair under general anesthesia. It was a slow night. As they're anesthetizing him, he aspirates, so we do a chest x-ray to see if he's got any spit in his lungs. What we didn't know is that prior to this emergency surgery, he'd been going to his GP for over 6 months, complaining about chest tightness. They'd put him on various different asthma medications, but none had any effect on him. The x-ray showed a massive dark mass in his left lung. We kept him asleep and transferred him to ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to tell them where he'd gone, why he'd gone there, and what was going to happen. He passes. A general anesthetic is absolutely ridiculous for a nail bed repair, but he refused to have it done under local. After talking with a colleague, the dark space in his lungs was the normal lung, and the rest was whited out because they were riddled with tumors. This man was in his late 20s, a non-smoker, and I couldn't move past the situation for months after it. Story 22, probably the worst story one can hear. My wife found a lump under her breast that was really concerning. It took her about 2 months to get a proper appointment to have it looked at. Doc diagnosed it as a cyst and fibroadenoma. She drained the lump, and it was fine. Grew back a week later and was bigger. Finally, after being in pain for weeks on end, the doctor said, "This is clearly not working, so we will do surgery and remove it." Upon going in for the checkup, thinking they'd take a look at the scar and healing, it turns out that she had stage 2, a triple-negative breast incurable disease. The surgeon was absolutely floored. The most upsetting thing was that while her main surgeon, Gino, who was fantastic, was on holiday, another male doctor told her any surgery would be merely cosmetic, and it clearly didn't bother her because he could touch the lump. I almost laid that doctor out in the office. When she got the diagnosis, he apologized to both of us for being in a hole. Unfortunately, this story didn't end well. Despite doing 8 months of therapy, chemo and radio, her disease returned 7 months later and ultimately led to her pass. So many people told me, breast cancer, that's one of the easy ones. My insert relative nobody ducking cares about here had it. She switched gynos twice because they wouldn't take it seriously. It's been 6 months now, and not a day goes by where I wish I could have taken her cancer away. She was damn 27 years old. Story 23, not a doctor. But I've been dealing with abdominal pain since a child, countless ultrasounds, doctor appointments, or visits. I was always told it was in my head. Recently had surgery for something unrelated. During the surgery, they had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis, and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck all they could do was free it. And they didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out. Story 24. I'm the patient in the story. When I was a toddler and started walking, my extended family noticed that I would waddle a lot. My parents didn't really notice it because they grew used to my funny walking. But my grandma and my aunts that saw me so much less often insisted that I had a limp. So my mother asked our pediatrician about it, and he reassured that it was nothing and would fix itself when growing. 1 year passed, and it didn't fix itself. It got more noticeable. My mother asked again to my doctor. She asked for an x-ray to make sure everything was fine, and the doctor was angry for wanting to expose me to the rays. He insisted it was nothing but referred us to a specialist anyway. The specialist suggested my parents put some wool around my leg that had the limp, because wool would warm it up and speed up the growing process. Right, my dad finally had enough. It was summer, and my regular pediatrician was on holiday. His partner visited me because meanwhile, the limping became really bad, and my parents wanted another opinion. The new doc measured my legs. There was a 4 or 5 centimeters difference between the 2 legs. They sent me to a specialistic children's hospital to get it fixed right away. I had severe dysplasia. So severe my right hip didn't have a socket for the femur bone. 3 years and 3 surgeries later, months of physiotherapy to learn to walk again, I was normal. If the second doc didn't catch it, I would have grown up disabled. He split up with his work partner, the first doctor. Second doc is now my daughter's pediatrician. Story 25. Asterisk tilde, asterisk not a doctor. Asterisk tilde asterisk not even a nurse. While working as a CNA on an ICU step-down unit, I noticed my patient was acting strange. Asked her a few questions, got some questionable answers. Thought it might be weird. As she couldn't really answer questions other than huh and uh-huh. Her gait was weird, like a trot rather than a normal walk. Plus, she was leaning. I was training another CNA, and I was like, no matter what you do, if you see something, notify the nurse and chart that you notified her. The patient was having a major stroke, and the nurse was too far up her own ass and her own phone to do an assessment. The woman had to go to rehab and was not a candidate for any stroke reversing. Drips, as I had charted that she seemed off 8 hours before. The only reason anyone caught it was because the night shift nurse insisted on bedside report. The nurse I had been working with yelled at me, "Stroke?" Like I hadn't been notifying her of symptoms all day. Story 26. A medical student here. Will be doctor in May. Working in ed shift, we found what was probably a missed balls torsion. Previous doctor told patient he probably had incurable disease when he showed up at our ED. What he had was probably a dead balls missed at initial presentation weeks prior. People with testes, especially young men, if you have sudden onset excruciating pain, sometimes without activity, often after, during activity, go to the ed immediately. It's one of the few things that would make a urologist lounging at home on the weekend turn on his Tesla ludicrous mode and go plaid to get to the hospital. Story 27. Yet another, not a doctor, but my grandmother had a lump on her tongue, and when she went to the doctors, the person who examined her said it looked benign, but didn't feel comfortable. So said she should go to an expert lest it become malignant. A more senior doctor decided against that and blocked the proposition. A couple months later, it is malignant and she needs half tongue loss plus tonsil. Story 28. I'm the patient in this story, but I still think it's worth saying. I started having horrible ankle pain when I would walk in grade school, and my doctor always attributed it to growing pain. I knew that was bullcrap, and so I kept annoying him about it. After multiple attempts at diagnosis, everything from knock knees to pigeon toe to just being weak, I finally went to a specialist. He asks me to flex my ankle, and so I do. No, all the way, he said, even though I was flexing as hard as I could. I could only flex my foot maybe an inch from its resting position. Turns out I had incredibly decreased mobility of that joint due to shortened tendons. He diagnosed me within 5 minutes, after years of my doctors brushing me off. After a few months of physiotherapy and a shoe insert, my pain decreased by a lot. Story 29. Obligatory not a doctor. I'm working as a carer while I study nursing. Discovered a 90-plus-year-old woman had a broken hip that the nurse who assessed her after a fall completely missed. Most elderly people who break a hip will pass within a year. Fast treatment is crucial, and it's a pretty ducking big thing to have missed. Story 30. I'm a dentist in the UK. While I was working as a locum in an emergency clinic, had a man present with a mouth of infection. He had wanted implants, went to a private UK dentist, who refused to do them due to the patient's heavy smoking and poor oral hygiene, which would mean the chance of success and good healing would be limited. The patient didn't accept this, went online and found he could go to Hungary and get the implants done for half the price and have a holiday. Came back, and within a few weeks, most of the implants are infected, and he sat in my chair. We gave him antibiotics to clear up the infection, but then had to inform him that the implants would need to come out, and he would need to find a specialist dentist with the necessary equipment to get that done. He was not happy. Spent all that money only to have to pay again to have them all removed. No better off and at least 10G down. Should have listened when the first person told him no. Story 31. Another, not a doctor. But my meal had all the signs of stroke. Severe headache, vomiting, vertigo, vision problems, partial paralysis. But was sent home from the ER and told it was an inner ear condition that would resolve on its own. When it did not get better, she saw her GP, who upon merely looking at her asked when she had had the stroke. When he realized it was still untreated, he immediately sent her back to the hospital. There they finally recognized that she'd had a major stroke. She could easily have died and was in rehab for weeks. They then claimed that it must have happened after she was there the first time because, and this is really unbelievable, her chart from that visit did not say that she had had a stroke. So much wrong with that statement that I don't even know where to begin. Story 32. I'm not a doctor, but a run. This happened to me, but isn't nearly as bad as most of the stories on here. When I was in college, I got to where I couldn't swallow. It started with difficulty swallowing, progressed to me having to swallow bites of food multiple times, regurgitating it, and then got to where all I could swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times and was told every time it was acid reflux and part of my anxiety disorder. I lost 30 pounds, was only 120 when this started, and was just generally miserable. Finally, my grandma was tired of watching me be sick all the time, so she called the guy doctor herself. They said we needed a referral, but she explained the situation, and they got me in the next day. Did an endoscopy, and my esophagus was 95% occluded at the gastroesophageal sphincter. For some reason, some of my primary doctor's notes ended up in my discharge paperwork. I guess they had to contact her to get my information. And she had told them it was acid reflux, and basically I was being overdramatic. She stated she did not recommend them to do the procedure. Needless to say, I switched doctors. Was not a fun year. Story 33. I'm a dental assistant, and a patient came in and his color was off. His jaw hurt and a tooth. He'd just come from the doctor who told him to see us. I was suspicious of heart attack. I put the pulse ox on him and almost fainted myself 82%. I grabbed our emergency high flow and yelled for the AED and 911. The guy was having a heart attack. The guy lived and brought me a big old heart-shaped box of chocolate at Valentine. I've never been so scared or angry for another person. The dentist I worked for called the MD and said, "My 25-year-old assistant just saved your patient's life." Story 34. I am a psychiatrist, and I am frequently angered by the lack of care that our patients receive from some other doctors. Emergency rooms can be the worst about this when they are trying to shuffle patients through to psych admits as quickly as possible, sometimes neglecting other basic aspects of care in the process. Not every ed doctor is guilty of this by any means, and some are remarkably good about providing appropriate care for this population. But it happens far too often. Probably the most egregious incident occurred a couple years ago while I was on overnight call at a VA hospital. So it started with a relatively routine call asking to transfer a patient to our psychiatric unit from a community hospital emergency department for treatment of psychosis. He was an older guy, I want to say early 70s, who had come in acting strange and delusional. His son-in-law had told the ed staff that he had received care with use for psychiatric issues before. I asked them to fax the transfer packet, a bundle of the assessments already performed there, and I started looking at his chart in the meantime. However, what I found was that he had not actually been admitted to our psychiatric unit. He had been seen by our psychiatry consults team for delirium while he was admitted to the medical floor for decompensated heart failure. For anyone unfamiliar, delirium can occur with any severe illness, where your brain basically isn't functioning properly due to the physiological stress your body is under. Sometimes it just manifests as confusion or disorientation, but sometimes it can get more dramatic with delusions and hallucinations. From what I saw in his chart, he had no actual primary psychiatric issue and had only been seen by the consult psychiatrist while he was delirious. So I get the transfer packet for this guy, and not only has there been no cardiac workup. For this guy who has a known history of heart failure, there aren't even vital signs on him. The only labs are a blood count, pretty unremarkable, and electrolytes, kidney markers. These chemistries are also not too abnormal, but I noticed that his urea nitrogen is a little elevated. This is generally a sign of poor perfusion through the kidneys, as reabsorbing this urea also helps the kidneys reabsorb every last bit of water they can when the body is dehydrated. However, dehydration and low blood volume is only one possible reason why the kidneys might see reduced perfusion. Another possible reason would if some had uncontrolled heart failure. So I call the outside emergency room and tell them that I will not accept this patient onto our psychiatric floor without at least a basic cardiac workup. I tell them his history, that he has only had psychiatric symptoms in the context of delirium from heart failure, and that the little bit of data they actually sent me points to that again recurring. They tell me okay, they will get the labs and vitals that I requested and reach back out to me. I didn't hear back from them after this, and I assumed that they had found evidence of cardiovascular decompensation and reached out to the medicine floor to transfer him there instead. So I'm going about my night, and a couple hours later I get a call to come evaluate someone in the ed. I'm down there and using one of the computers at their desk when I hear one of the ed doctors mentions about a patient coming into medicine from the same hospital. For anyone unfamiliar, transfers to the VA pass through the ED first, despite this literally being illegal to do in other hospitals. I don't understand the reasoning behind it, but it's what they do. Curious, I ask if it's a guy coming in with decompensated heart failure. I'm informed that not only is it the same guy who will probably be getting a psych consult for delirium, but that he had actively been having a damn heart attack in their ed. Needless to say, I was pretty upset that this outside ed had tried to send this guy to our psych unit, where it is a lot harder to get other medical treatments, without even getting vital signs on him or realizing that he was having a heart attack. I tell this story to medical students who are rotating through psychiatry all the time to try to hammer home the point that just because someone is acting bizarre doesn't mean that you can just throw the psych patient label on them and ignore everything else. Story 35. I'm not a doctor, but when my son was 2 years old, he wasn't pooping normally. His stomach was getting bigger, and he seemed to be always taking more food in than was coming out. We brought it up with our family doctor, who suggested laxative or some natural remedy. I don't remember the details of the natural remedy, but when I mentioned it to another doctor later on, they were horrified. A few months later, and no improvement, we brought our son back to our family doctor. She said the same thing. What if it doesn't improve? It definitely will. It did not improve. A few visit to the ER and a lot of doctors asking a lot of questions kind of frantically, and we found out he had a condition called Hirschsprung's disease. He went in for emergency surgery and is doing a lot better now. At the time, it was really scary for a while though. A short while after, the family doctor decided to retire early rather than face a disciplinary hearing from the professional board. I don't know the details, but based on how pissed off the surgeon seemed to be at how the doctor handled things and the timing of it all, I suspect the surgeon reported our family doctor for improperly handling things. Story 36. Doctor here? You guys would seriously be surprised at how much ineptitude there is even within our ranks. I once had a new admission come to me overnight in the hospital who was admitted by someone else the evening before. The patient very clearly had an out-of-a-hospital cardiac arrest at a local casino with a defibrillator used with return of spontaneous circulation. The history was clearly described by the admitting doctor, however they called it syncope, or passing out. They had ordered a cardiac stress test for the morning. I caught it early that morning, ended up needing to go emergently to the cardiac catheterization lab and getting stent to heart artery, which was the cause of their hearty stopping. If the admitting doctor had actually obtained a stress test on this patient, it would have killed them. I have literally tens of stories like that. It feels like half the doctors I work with are gits and literally don't care. Story 37. Not a doctor, but the patient. I was given someone else's medicine while in the hospital via an IV. The nurse realized after I had finished the bag that she screwed up, then hid the bag in the garbage. The night nurse brought it to my attention because he was confused that someone else's used IV bag was in my private room. I was on a severe liquid restriction at the time too, so there was an extra couple 100 ml of fluid that I should have not had. A few other things that happened during that time in the hospital. Left in my own feces while in a coma for hours that resulted in it eating away and breaking down my tissue on my coccyx. Was restrained and severely burned as a result. They didn't use the pads like they're supposed to, or ask family. Skin blackened. Almost lost my hand. Oh, I should explain I was restrained because I was coming in and out of the coma. Tried to scratch an itch and accidentally pulled out my nose feeding. My PICC line was pulled almost completely out and was given a lot of potassium. Now, if it's pure potassium, it will burn. Since I was on a fluid restriction, it couldn't be mixed with saline. My arm would swell, burn, red. It was so painful. It took about a week before someone realized, well, this doesn't look right. Booking agent screwed up on an appointment, so I ended up getting a vital checkup and blood work when my cardiologist and the infectious disease specialist weren't on site. Blood work was drawn wrong and no one thought to double check. Was not told my true results from another blood test, which led to me almost pass 1 week later. Story 38. I'm the patient, but it's an important story to tell. From the age of about 17, I start getting regular abdominal pain every day and terrible gut problems. I can't seem to eat much anymore. I get fluctuating diarrhea and constipation. Menstruation gets more and more painful. Now you would think any doctor worth her salt could figure out it's a gynecological problem. But my doctor, a woman by the way, at the time insists it's anxiety and says she wouldn't bother testing for or treating a gynecological problem unless I was older and having trouble conceiving. Over the next few years, my gut and uterus symptoms slowly deteriorate. I get bounced around the system to dozens of different specialists. I get told it's just stress, anxiety. Are you pregnant? Are you sure you're not pregnant? Every woman has painful periods. It's just constipation. Take this over-the-counter product, etc., etc. Meanwhile, my gut function slowly grinds to a halt. A functional gut test took 6 hours to pass an egg sandwich, when it should have taken 90 minutes. I weighed only 40 kilograms. It gets so bad I even start losing bowel control. No treatment seems to work. I was 24 and unable to work because I was literally uncontrollably crapping my pants. Doctors suggest I should maybe seek therapy and suggest I could be exaggerating anyway. One day I see a new GP for some regular health tests, but get an abnormal pap smear. Within 2 weeks, I go in for an exploratory laparoscopy to discover I'm absolutely riddled with endometriosis. It was even in my gallbladder. With excisions plus treatment, I had my gut function back within 3 months. I will never be able to have children. If that woman when I was 17 had just done her goddamn job, I wouldn't have lost 7 years of my life, my gallbladder, my fertility, and my mental health. Story 39. Another, not a doctor, but my mom who's a nurse. I was 15 and had fallen on my wrist while playing football in PE at school. School nurse who was friendly with my mom through nursing circles said to keep an eye on it during the evening. Later that afternoon, I'm in agony, but my mom wasn't having any of it. Said if it was hurting, I'm old enough to cycle to the DARS myself. I tried to explain the importance of breaks and wrist usage. After enough whining, she finally takes me, and then on to the hospital after they said it was broken. She sat very sheepishly in the waiting room after hearing the prognosis. Fast forward 3 years later. My stepbrother comes back home for the weekend from UNI with a sore wrist from getting into a fight. Same quit whining, it's fine response from her. He goes to the UNI health center when he gets back and then is taken to hospital for surgery and a pin put in place. Story 40, rattlesnake bite. Patient and dad out in the fields near a small town that is several hours away from the nearest big city where I work. Dad takes the child to the ear in the small town with an obvious snake bite. Doctor there says, hey, it's okay, she probably didn't get envenomated. Doesn't give the patient anti-venin, which they had at that hospital. And instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later, patient shows up to our hospital coding and ended up pass. Probably didn't get envenomated? What the duck kind of stupid-ass idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated and you treat them as though that had been. That means anti-venin, physiological support, etc. Completely absurd. Story 41. When in training, I saw a child suspected of having meningitis. While I was new to pediatric medicine, I had a gut feeling just by looking at the 4-year-old patient that he was too sick just to be a regular child sick. The thing that tipped me off was the child having a slight delay in the pupillary reflexes. After seeing the child, I asked the head pediatrician to do a lumbar puncture to investigate the spinal fluid for signs of infection. She said there was no need, and all signs pointed to some airborne virus that roaming around that time. An unnecessary lumbar puncture can scar children for life and whatnot. While I didn't agree, I mistakenly doubted my own assessment and assumed the doctor, with tens of thousands of hours of experience, would surely know better than me. I shrugged. I wrote everything down in the dossier and asked the pediatrician to read my evaluation afterward. I went home after an exhausting evening, having worked almost 14 hours straight. 3 days later, the child came back with a fulminant meningitis that had taken a bad turn. When discussing the patient, she remarked she noticed a bizarre pupillary reflexes in the patient. Not only did she discount my suggestion of doing a diagnostic lumbar puncture, she also did not read my evaluation of the patient 3 days earlier. I learned to never doubt my gut feeling, and it has led me some outlandish diagnoses. Story 42. Patient. While I was pregnant with my youngest, I had really bad acid reflux. I lost 30 pounds because I couldn't keep anything down, not even water. It was so bad that I would cry and throw up all the time. I got hospitalized for dehydration at the end of the pregnancy. My then nurse practitioner said that I was overreacting, and it was good for me to lose weight because I was too big anyway. I understand I'm not skinny, but I'm not morbidly obese. I had the baby and it didn't get better. I was told it would. Popped those antacids like candy. Couldn't keep anything down and cried. A lot. One night it was especially bad. I was vomiting and the taste, smell coming from my mouth was just horrendous. I was trying not to cry during all this. Anyway, made it to the hospital again, and the doctor there was like, "Were you not here a few months ago?" Of course I said yes. I got a shot of gravel in the hip and it didn't get better. They gave me something else and still nothing. By this point, he's like, whoa, okay, she's not pregnant anymore, so what gives? Calls a surgeon over, she orders x-rays, and it's found that my gallbladder is super inflamed and needs to come out. Too far gone to save it. She ordered a mess of medication because finally, someone believed me when I said I was in so much pain. It took a week before the swelling went down enough for me to get surgery. I am so grateful for this surgeon. Story 43. Not a doctor, but the patient. And it's nothing major. I have anxiety that can get pretty bad when untreated. I went to see my general doctor about it and tried to explain my symptom. She told me it was heartburn. I tried to explain that I thought it might be anxiety, and she yelled at me. She got upset and told me how everyone is stressed and how these are stressful times. It's normal. I was having heart attack symptoms, and I'm far too young with no heart problems to be having a heart attack. I went to a new doctor, and before I could even finish explaining, she cut me off and said, "Yeah, you've got anxiety." I was out on meds, and within the week I was feeling better. Story 44. Obligatory, not a doctor, but I'm a scientist. Last week, I was left a bunch of blood films to look at by a colleague who, after a long night shift, insisted they were mundane and I should just deal with them when I get the chance. I decided to clear them off immediately, and the first film I looked at was a gentleman with a hemoglobin of 43, platelet count of 37, and a film jam packed with blasts. It must have been about 40% blast cells. Naturally, I'm immediately in acute leukemia mode, ringing urgent care and the consultant who drags this poor man out of bed and into hospital. Spoke to the consultant today and was told the patient works offshore and is dealing surprisingly well with his condition. My colleague didn't miss the diagnosis, but did miss that film from his queue entirely. Story 45. Not a doctor, and this is about my husband. After we got married, we struggled a lot and nearly divorced, because he would go through phases where he behaved like a different person. I'd kind of noticed it before marriage. But then I stopped working, and it became clear that he really was struggling with it. He had had a lot of problems his whole life, starting with getting a felony when he was still in middle school. By his early 20s, he was in prison because he was doing substances, burglarizing homes, drinking and driving like a maniac, etc., etc. He got a variety of diagnoses like narcissistic personality disorder and sociopathy, but never was really treated or medicated. One doctor told him he was untreated. Despite all of this, my husband got out of prison, stayed sober for years, got a bachelor's degree, graduating with honors, moved to a new city, but then started struggling again with alcoholism before I met him. We partied a lot in the beginning of our relationship. Fast forward to a few years later when we are married and mostly sober and living in a new city. And my husband is periodically acting totally crazy, and then going back to normal after about 2 weeks. I started charting his behavior and statements he made because he would say things like, "I never need more than a few hours of sleep, babe." 2 weeks later, he would say, "I always have a hard time getting up in the morning, babe." I had my own DSM-IV from when I was a psych major in college, and I started comparing his symptoms to bipolar disorder. He met basically all of the qualifications. I was able to convince him to start therapy, and bingo. He got a bipolar diagnosis within a few sessions, especially after reviewing his history. Even so, everyone was reluctant to prescribe him medication. A full year went by, and he was still really struggling. Then he went into a full-blown manic episode and started saying things like that he felt like he couldn't control himself, so I took him to the ER in the ER. I told the doctor I wasn't leaving until he got medication because he was clearly suffering and needed help now. The doctor not only 100% agreed, she actually called his therapist and lectured her for not trying harder to get him medication. He got a hefty dose of Seroquel. We went home, and he slept for 2 days. He woke up like his normal self again. It took another 2 years of trial and error before his medication was balanced out, but the difference is amazing. My husband had been considering surgery for a problem he had with excessive sweating, but it went away when he got the Seroquel. Actually, a huge list of problems, like rapid heart rate, insomnia, difficulty keeping on enough weight, nausea every morning, and on, just disappeared once he was medicated for his mental health issues. Even his alcoholism just vanished. No joke. He struggles to finish a beer and rarely even opens one. Now he is basically as normal as someone without mental health issues, and often wonders what his life would have been like if he had gotten proper help at so many different points in his life. He never stood a chance without medication, really. And then, even when we knew what was wrong, what would that year of our life, when we nearly divorced and my own mental health spiraled out of control, have been like if he had gotten medication right away? I know mental health can be tricky, but his problems were brushed aside over and over again by numerous mental health professionals. Story 46. Not a doctor, but I had a half-assed dentist. I went to a dentist's office for several years and was repeatedly told to get braces and have my wisdom teeth. Both of these pose an issue, since I play trumpet for a living. And performing at a professional level is difficult to impossible with braces. And having wisdom teeth out would put me out of work for at least a month during recovery. The dentist was told this repeatedly, during every visit. I decided to get a second opinion about the wisdom teeth, so I went to an oral surgeon to have them look at it. They took x-rays and looked at the records from my dentist. Then the conversation. Oral surgeon, so you're experiencing a lot of pain in your wisdom teeth, according to your record. Me. I'm not. At all. I never have. Oral surgeon. So, I'm just going to assume your regular dentist falsified the rest of your record too, so I can put this folder down and do my job. He then went on to explain that the way my wisdom teeth came in, they're sitting on a nerve that's next to impossible not to cut in the process of removal, which would leave me without feeling in the lower half of my face for the rest of my life. As you might imagine, this would also be a major issue given my career. I was advised that if they're not in pain, not to worry about them. I do need to extract an adjacent tooth to one of my wisdom teeth, though, which my regular dentist completely blew off when I asked about it. I never went back to my regular dentist, and will be starting with a new one soon. Story 47. I'm a PT, and patient was referred to me with low back pain, and after evaluating him, I referred him to the ER for suspected kidney issues. He had a kidney infection. Story 48. During my residency, we had this lady in her 60s who was getting progressively more forgetful, just overall declining, and getting less and less able to take care of herself. She had been seeing her PCP who diagnosed her with dementia, and she saw a neurologist who agreed she was not really able to provide an accurate history. After talking to her family and friends, it became apparent that her symptoms were progressing unusually quickly. I remember seeing the point where her new hair growth met her bright red dye, and also her grown-out nails with hot pink polish, thinking, wow, it really wasn't too long ago that she was not only taking care of herself, but going to get her hair and nails done. The lady in front of me was so far from that. The neurologist I was training with recognized this, had her admitted, and did every test, including lumbar puncture. Workup eventually showed Creutzfeldt-Jakob disease, mad cow, which there is unfortunately no treatment for. She passed a few months later, but at least we were able to prepare her family that she would only continue to decline so they could make arrangements. Really sad situation. Story 49. I'm the patient. Had a breast incurable disease found by an NP at a county health department. She didn't tell me about it. I found it while doing a self-exam in the shower a week later because I've always been on top of that crap. I didn't go back to the doctor for months because I figured the NP would have told me. 4 months later, I'm diagnosed with stage 2 breast incurable disease at 30. Do your self-breast exams and don't let anyone tell you you're too young for anything serious. Story 50. Not that anyone will see this, but started taking my daughter to the doctor for abdominal pain when she was 12. Excruciating, can't function abdominal pain. Tried tracking pain cycles. Nothing seemed to add up. Doctor after doctor, specialist after specialist, all literally told her it was in her head. to the point that, on top of the rest of what was going on with her life, caused her to develop some massive mental health issues. At 19, she ended up in the air again for abdominal pain, and they saw a cyst on her ovary. A few weeks later, she's scheduled for surgery to remove it. After a surgery that lasted a couple of hours longer than a cyst removal surgery should have, the surgeon came out and said, "That is the worst case of endometriosis I've ever seen in my entire career." Granted, she was a gynecologist, but those are heavy words. At 21, after having exhausted all avenues for controlling the endometriosis, she had a full hysterectomy. Even prepping for that surgery with a surgeon that specializes in endometriosis and is best in field, the nurse's anesthesia said they were warned that this is one of the worst cases he's seen. I so badly want to go back to all the doctors I have taken her to and say, look, she wasn't faking it, simply so that it's something they can take into consideration, and maybe the next kid won't be in the same position my daughter was. Story 51. I am 29 and been having chest pain for the past 3 years. First doctor, I went to said that I was just stressing myself out thinking about it. The wife convinced me to go to another doctor who took me seriously and did an echocardiogram and sleep study. Turns out I have a pretty serious congenital heart defect that requires me to wear a pacemaker or I could pass. The crazy part is up till 26 years old or so, I was in amazing near Olympic level shape. Doctor was stunned that I was still alive after explaining my workout routine when I was younger. I owe my wife my life now. Story 52. AIDS, as in the patient had no working white cells whatsoever. It all started with what appeared to be a fungal infection in the chest. But after many pulses with it, riconazole, the plaque was still present and growing. So the physician called me to check the patient, and the chest plaque was indeed very suggestive for a fungal infection. The direct examination even confirmed the existence of the fungus, but the treatments were doing nothing. So I rechecked the file and behold, the leukocytes count was quite low. A quick HIV test later, and the patient was diagnosed with AIDS on top of its body function. To the credit of the physician that called me, the patient lied on the clinical exam as he marked he had no active 18-plus life. But when confronted with the evidence, he spilled the beans. Turns out he was a regular with the local escort, but also quite active in online dating. Public health wasn't happy to say the least. Story 53. While I was doing a trauma and orthopedics rotation in a small hospital with a decidedly ropey AE department, I was asked by the medical team to review a 67-year-old lady that had fallen at home. She had some shoulder pain. A had x-rayed and ruled out broken collarbone and shoulder and referred to medics to investigate cause of fall. She still had pain and medics didn't completely trust Ed, so asked me, the chubby but mostly competent shoe, to have a look. Looked at the x-ray first, nothing broken, then saw the patient, shoulder a bit bruised but good range of movement. Felt the shoulder a bit more, felt some weird lumpiness under the skin, thought, crap, this is surgical emphysema. Went back the shoulder x-ray, looked at the snippet of lung in the x-ray and saw a big pneumothorax, punctured lung, and a hint of some broken ribs. Emergency chest drain and transfer to trauma center. Patient survived. I don't think the Ed doctors had even laid hands on the patient. Just looked at the x-rays and referred on. Story 54. Here's my story. A guy came into our ICU and was very septic but still talking. He had visited his primary care MD with complaints of a sore throat for a couple of days. Dismissed without any intervention since he didn't appear to have strep throat or the flu. At this point, he was having pretty severe abdominal discomfort, so we sent him for a CT scan. As the scan was finishing, he coded and had to be intubated, multi-organ failure, etc. The CT scan was horrible. He had all kinds of crap all over his peritoneal cavity. His wife told us that he had choked on an ice cube the day before he saw his primary care MD. Evidently, he swallowed a whole double half-moon-shaped ice cube that perforated his esophagus with a huge linear 4.25-inch tear, allowing a significant portion of his swallowed food and drinks to get into his peritoneal cavity instead of his stomach. To make things worse, he had some reflux that allowed stomach acid to get in there as well, likely while he was sleeping. Once we realized what was going on, he went for extensive washout and exploratory surgeries to repair the damage to his esophagus and other organs. Thankfully, he made a full recovery, but he was very close to not making it. Story 55. A PT presented with stroke-like symptoms, weakness on one side, blurriness, super high BP, etc. Works in the hospital, told his manager he was feeling these symptoms and was directed to OUEOS. They saw him there and told him, "You're fine, go to a walk-in clinic after work." He went back to work, and luckily his manager was like, "Nope, go to the ER." We got him there, and after a stat head Keat, he had a current intracranial infarct and 3 old infarcts never diagnosed, 4 strokes, and was told he was fine. Go to a walk-in clinic after work. Wow. Story 56. PT here. Just yesterday tried to see a patient around 9 a.m., but he had to get a blood transfusion. So we chatted a bit, and I said I'd come back later. Come back at 11:30 a.m., and he's full on belly breathing, extremely lethargic and unable to talk to me like he was before. Mentioned it to the nurse. and she said she was aware but also didn't check on him. Came back again at 2 p.m. to find out that an hour after I said something, they decided he was having a reaction to his blood transfusion, and it was finally stopped. He was headed to the ICU by the end of the day. Story 57. He put the pacemaker lead in the subclavian artery and across the aortic valve into the left ventricle. The proper approach is subclavian vein to right ventricle. And then he didn't notice it for over a year. I saw the patient, a 25-year-old woman who didn't need the pacemaker in the first place, when she was in congestive heart failure because the pacemaker lead had destroyed the valve. A surgeon and I had to do surgery to remove the pacemaker and lead, then replace the aortic valve. Totally inexcusable. Well, 50% of doctors are below average, but everybody thinks theirs is in the top 10%. Story 58. I had a rich patient who'd gone to 2 separate dermatologists about a bump on her back. It changed size over the month as key info. It did. They both diagnosed a fatty lipoma. She asked me to check it out. I said I'd have my esthetician boss really deal with it, but I would take a look. The second I touched that enormous white head desperately waiting to burst, it started oozing out. White puss. When I actually pushed on it, the entire thing exploded everywhere, and I was that lady's hero. I was a lowly acupuncturist, but I knew fatty lipomas do not change with your period every month. Story 59. I'm a PA. 20-something-year-old female went to her PCP with calf pain. They gave her a muscle relaxer. She obviously had a blood clot and ended up in my ER, in cardiac arrest with a massive pulmonary embolism. Last I heard she was in the ICU on ECMO, but I don't know her final outcome. Story 60. Not a doctor, but my mom kept having really bad stomach issues, and her doctor told her it was from acid reflux and put her on medication that she was supposed to take every day. She wasn't feeling any better. So she tried going to a different doctor, and they found an ovarian cyst the size of a tennis ball, and the medication she was given was only supposed to be taken as needed, not every day. Every day could have given her throat disease. Story 61. My wife has severe celiacs and gastroparesis. She complained about being in pain, her stomach hurting, etc. for years, and her parents and doctors just chalked it up to her being a girl and a drama queen, which she is not. She has always been one of the most level-headed people I know. She didn't get diagnosed or treated until she was 21, and her body was basically shutting down and eating itself because it couldn't process nutrients. Now, in addition to her celiacs and gastrop, she has a ton of food allergies, autoimmune issues, cysts, and decreased fertility, because no doctor was ever willing to take 10 ducking minutes and listen to a teenager with consistent symptom. I love her family, but her mom tries to downplay how she ignored my wife, and it makes me furious. Story 62. Not a doctor, but when I was 16, I was studying to be a nurse, and I got sent on a shadowing work experience to a nursing home. The worst thing I've seen overlooked is loneliness. There was a resident, I'll call him Mr. R. I had a little free time on my second day, so I went exploring to try and learn the lay of the land. On my walk, I glance into one of the rooms, which had their door open, and see the resident inside coughing, and spitting up phlegm on his own shirt because he had nothing else to cough into. I run and get him a box of tissues. While he's wiping himself down, I sit opposite him, waiting in case he needed anything else of me. He sees I'm new. He thanked me for the tissues, and we began talking about the pictures, and he told me his life story, about his time in the army, how he met his wife, about how he missed traveling to Sweden every year, all the dogs he'd had throughout his life. He was the first person to talk to me in a friendly manner at the placement, and I really enjoyed chatting with him. He was funny, smart, and overall just a nice person. He had lived a long and interesting life, and since he had no children, it had been a while since he had spoken to a teenager. After about 20 minutes, a member of staff knocked on the door and told me I was needed. I said goodbye to Mr. R and promised to visit him again during my stay. I thanked him for making me feel so welcome, and he thanked me and began to cry. He said no one had ever done that for him. Mr. R had been at the home for 3 years. In all that time, no one had just sat down and talked to him, asked him questions, and genuinely listened to him, made him laugh, made him feel heard. I ended up making several formal complaints and inquiries about multiple problems I witnessed and encountered. Manhandling, neglect, unclean environments, belittling language towards residents, and a general lack of care was just a few. It was the first time I'd ever been both so heartbroken and angry. As a caregiver, one of the fundamentals is that you have to care. And for one reason or another, those staff had forgotten. There were a lot of things I saw at that placement that I will remember for the rest of my life. But the hanging feeling of isolation was the worst. Story 63. In my psychiatry residency, I was working in the psycher one night when we got a transfer from the main ER. Her family had brought her in for altered mental status that had been getting gradually worse over the past 2 weeks. She had been cleared by the ER doctors. All labs and vitals had been normal. And I was told she was likely having a mental breakdown or psychotic episode. She was rolled into our area and I went to assess her. She was non-responsive, staring off into space, crying and shaking her head back and forth and mumbling. She could not answer any questions and seemed to be having a tremendous amount of anxiety. As a psychiatrist, one of the biggest lessons my mentors taught us was to assume a change in mental status is always a medical condition until proven otherwise, and then you can think about psychiatric causes. Within a couple of seconds of me seeing her, I had a gut feeling this was not psychiatric in nature. I looked through her chart and saw she had a history of blood clots in the past. Her vitals were rechecked, and again they were totally normal. At that point, I made an executive decision and ordered a stat SOT of her chest looking for a possible clot. The technicians who came to take her for the study were slightly confused as to why a psych resident was ordering this. And the radiology team even called me and wanted to make sure I had not ordered it by mistake. 30 minutes later, I get a call from the on-call radiology resident, and she says, "Are you the psych resident that ordered this CT?" "Yep, that's me," thinking I was about to get some comment about wasting their time. She continued, "And this patient is in the psych ER?" "Yes." "Well, you better call the ER and have her transferred stat, because this lady has the most massive pulmonary embolism I've ever seen and will likely code any second." So with that, we transferred her back to the ER. She was admitted to the hospital and treated for her clot. Within a few days, she was back to normal. From then on, whenever someone would make a joke about a psychiatrist not being real doctors, I would tell them this story and that would settle it. Story 64. Speaking for my ER nurse who, reasonably, freaked out and put me in quarantine meningitis. I'd been having migraines for the past couple of months that were steadily increasing in severity. About halfway in, I couldn't go to work. I could only lay in bed, moaning in pain. I went to an urgent care doc who told me it was the flu. This had the audacity to listen to my story about being bedridden with increasingly bad migraines, swab me for the flu, have the test fail, and still say it was probably the flu and to drink more water. Flash forward to the next weekend, I went into the ER. Nurse looked me up and down, listened to my story, and asked if my neck was stiff. I said yes, and while he kept his composure, he freaked out when I got weirded out about the prospect of inpatient care. I signed off when I was able to catch my breath for a second. The guy was trying to stress how important it was that I sign off right away. But I don't do well under pressure, so he escalated and told me I was in imminent danger, and anyone I'd been in contact with recently was as well. That didn't really help my situation. I just panicked more, but when I was finally able to convince him I literally needed 5M to breathe and process, everything resolved, and I signed in. They did the thing where they take brainstem fluid from your back to figure out which variant I had, threw me in a quarantined room, and I was there for 2 weeks. If you're as unfamiliar with the disease as I was, it has 2 different variants. One kills you and is a problem. One is usually not really a problem. It got to the point where I couldn't answer basic questions about what I did at work. Work called because I was the only guy who did know. But luckily, my boss was a smart guy and pieced it together. Luckily, I just had a severe case of the one that doesn't hit you. I was out of commission for 2 months straight. Couldn't even look at a computer screen without instant nausea. So yeah, if that urgent care doc is out there, you done goofed and led to one of the scariest moments of my life. Maybe don't do that to other people. Story 65. Not a doctor, but a doc brushed off my knee pain. I was tossing a frisbee around and went up to catch it, landed on a hill and heard a loud pop. Couldn't really walk on it. I took a couple days, let the swelling go down. By that time, I was walking again, but I fell off. Went to the doctor. She looked at it, did a strength test, and said it seemed fine. I felt like I must be being dramatic. 5 years later, I finally went to a doctor about it after I tweaked my knee during a mud run. She ordered x-rays and an MRI and found out that I tore my ACL. But because I had likely torn it years ago and wasn't provided with any physical therapy or surgery, my knee had some additional damage, a torn meniscus and a ducking divot in my femur, because my years of continued activity had worn down my cartilage. And once that was gone, it was just bone on bone. Story 66. I was 26 and found a lump in my breast. Planned Parenthood had taught me self-checks, and so I knew it felt different than a cyst. It felt exactly like the tumors I'd been taught to recognize. First doctor says, "You're too young for breast cancer." I didn't accept that and went to a second doctor where I got, "It hurts when I mash it right." No. "It gets bigger with your period, right?" No. "Sure it does." Third doctor, "You'll have an ugly scar if I biopsy it." Fourth doctor, I told him to call the police to get my naked, topless self off his table because I wasn't leaving without scheduling a biopsy. It turned out I had stage 2 cancer and after surgery, 9 months of chemo, 3 months of radiation, and being told I couldn't have kids, I survived. I now have 3 kids and I'm 62 years old. If you think the doctor is wrong, get a second, third, whatever opinion. Listen to your suspicions. Your story 67? Not a doctor, but for years I've had migraine. They were mainly behind my eyes, but I chalked it up to stress and hormones. So did the neurologist I went to see for them. She seemed annoyed that I kept saying the pain is behind my eyes. In my temples, and the pressure was insane. She gave me Imitrex and sent me on my way. I went to visit my eye doctor for a checkup, and she did the exam and asked if I get headaches. I told her yes, but it seems like I always had one. She told me my optic nerves were very inflamed, and excess, a tumor, can be the cause. She sent me to a neuro-ophthalmologist, where I had a brain MRI, a spinal tap, and new medication to help keep my spinal fluid in check. The neuro-ophthalmologist said I was about 6 months away from vision loss, that I was lucky I mentioned my headaches to my eye doctor. After the spinal tap, they took out about 100 cc's of fluid and measured the pressure at 42 when normal spinal pressure is 8/16. Big middle finger to the neuro who shoved substances at me. Story 68, not a doctor, as they say, but I have some experience in this area. First, my grandfather. He was a pretty good dude, coached football at a D3 school. Then later in life, after retirement, he started having strange episodes. It began in an almost humorous way. He was conflating the remote control with the phone, the dishwasher with the oven, spilling more coffee on the carpet than should be legal. I lived within about an hour away, so I was the first to be called and spent many nights checking in and cleaning up. During our time together, I noticed some particularly bizarre things, like the trail of coffee spills from his chair to the kitchen on the beige carpeting. He pointed at it one day and said, "You see that? I remember that from biology class. You know what those are? Amoeba." This was funny to 20-year-old me, but would turn out to be a clue to the actual problem. Eventually, his condition worsened to the extent that he was going out alone at night in the middle of the cold winter, and even had a couple of bad falls on the ice resultantly. The family doctor diagnosed this as dementia, and he was moved from his apartment to an Alzheimer's unit at the local nursing home. We emptied his place, got rid of many of his belongings, and he was moved to a room that had a special alarm on the chair, because every time he stood up, he fell over. My dad, who had been divorced from my mom for over a decade at this point, was not exactly his X-Files best friend, but he heard that he was having other hallucinations, such as thinking he lived in a house in town he hadn't been in since 1960. Given my dad's experience with dementia and Alzheimer's, he mentioned it was quite strange that he would be having hallucinations rather than memory loss. As such, my dad had the person who analyzed the medication combination for clients at his nursing home take a look at my grandpa's list of prescribed medicine. Quite surprisingly, he had been prescribed a sleeping pill in the mornings. We brought up the issue with his doctor of 50 years, and the guy wouldn't listen. Instead, we fired him, got him off the pill, and no crap. 2 days later, he could not only walk, but gave a speech at the Friday night quarterback club meeting at the university and was on point. The amazing conclusion was that he was back to his old self, well enough that he married his nurse from the Alzheimer's unit and spent 15 years with her happily. Duck that doctor. Story 69. Okay, I've got one, but I was the patient. I was young and I went to the doc because I had a cyst growing on my inner labia. Super painful and embarrassing for a young girl. I explained what was happening. The doc asked me if I was a virgin, and I said yes, and then proceeded to give me a literal exam. I remember being horrified by this and confused as the cyst was on the outside of my body and up north. I was sent home with antibiotics. The cyst grew bigger, so we went to the hospital. I was examined by another man, and they had 2 interns in the room as well, which was so extremely embarrassing for me. Again, he gave me an internal exam and told me they couldn't see anything. Sent home again. Returned a few days later because the cyst had grown so big I couldn't close my legs to walk. It was literally the size of a ducking golf ball. Finally, a woman doctor saw me and saw it right away. Normally, a cyst on the labia can be lanced and drained, but because it had been left so long, I had to be put under and have it removed surgically. What I don't understand is why I was ignored multiple times when explaining it was on the outside of my body, not on the inside. I'm now 28, and I'm still a bit traumatized by that experience. I feel violated to this day. Story 70. I'm a young 21-year-old college student, and I've been suffering from really bad stomach cramps, diarrhea, constipation, etc. since I was 14. I went to countless doctors, and everyone told me it was related to my period. As I got older and the pain continued, I went back to the doctor and again was brushed off, given some pills, told I had anxiety, and told to eat a healthier diet. I did all those things, and the pain and discomfort persisted. Finally, a few months ago, one doctor ordered a CT scan and saw a ton of inflammation in my large intestine and colon and freaked out. She ordered me to get a colonoscopy immediately. Turns out, I have ulcerative colitis, which is a Crohn's autoimmune disease. Story 71. Not a doctor, but my grandmother saved my father's eyesight because she didn't listen to their doctor. As a child, my father had really large eyes, too large. My grandmother was concerned, but the doctor kept brushing it off as normal. That anxiety-ridden woman got herself and my infant father on a train to SF to get to an eye specialist, against all others' advice. My dad was diagnosed with primary congenital glaucoma and his eyesight was saved. Go, Grandma! Story 72. I'm the patient in this story. Had my wisdom teeth removed a few years ago on a Thursday morning. The rest of the day was fine, but about halfway through the day after the extraction, Friday, I started having a lot of pain, which I realized was probably normal. By Saturday, I was in crying pain and started to have a lot of neck stiffness, and I could not open my mouth more than about a centimeter, just enough to force pills through my teeth. I called my oral surgeon's cell phone, and he said to keep taking the antibiotics they gave me and keep irrigating the sites, and this was totally normal. By Monday, I noticed a very sore spot developing on the right side of my neck. Still couldn't open my mouth and couldn't eat. Tried to go to work on the following Tuesday, but was sent home immediately by my boss because of how bad I looked. My surgeon was out of town that day, but I went to his office and was seen by the office manager, who is a nurse. She told me to open my mouth, but I couldn't. She got pissed and said, "If you're not going to open your mouth, then I can't help you." I literally could not open my mouth. She tried to pry it open with a tongue depressor, but it snapped and I screamed in pain. She pulled my immensely swollen cheek out and said that they don't look infected. But if I wasn't magically better by that night, she would get me in to see a different surgeon, since mine was gone for the week. She said she thought me not being able to open my mouth was out of fear that it might hurt to open it. You're just going to have to force yourself to do it. The next day, the right side of my neck had a lump the size of a golf ball protruding from it. I could barely swallow because of the pressure and pain, and I was taking 20 pills a day for pain. I went to the ER that night. They did a KEAT with contrast dye and found I had developed a huge abscess in my neck from the lower right extraction site, and it was starting to close off my throat so I couldn't swallow. Saw a different surgeon the next day, Thursday, and he also tried to pry my mouth open, to no avail. Scheduled me for surgery that day and said, "I bet your mouth will just fall open once we get you sedated." It didn't. It took the surgeon and 2 nurses in the OR to manually open my mouth while I was sedated because I developed trismus so bad that I truly could not open my mouth beyond that centimeter. They drained the infection. I ended up having 3 surgeries in 13 days, had 3 different antibiotics, lost 15 pounds in a week and a half, weeks of facial exercises and massages, and took a full month to recover from the major infection. I was scared to death that my face was going to be permanently changed because of how swollen and unrecognizable it had gotten. All because the original surgeon brushed off my concerns and the office manager, nurse, was in a hole who didn't believe me. Story 73. I'm hitting my 30s and I have scoliosis. I was about 5 when my doctor told my parents. It was very mild, and the doctor told my parents that it was normal, so they didn't think much of it. I grew up having mild back pain. It got worse when I had my first child. My scoliosis is not severe, but it's extremely uncomfortable. I have trouble sleeping, and being pregnant is hell for me. I told my parents that many doctors have told me why I never got surgery, or had a brace growing up since it could have been avoided. They always said growing up my pediatrician never suggested it or gave them info about what scoliosis exactly was. They always assumed I would grow out of it. Story 74. When I was a resident, an 80-year-old female was admitted from the nursing home for confusion. Workup showed some mild UTI, and we were giving her antibiotics. The nurse mentioned that her toe looked dark and asked me to look at it. The toe wasn't just dark, it was mummified. So the patient from a nursing home had a mummified toe, probably for months, that no one knew about. Story 75. Not a doctor, but my mom went to her doctor saying she was worried about weight gain around her tummy. Also had fatigue, nausea, a couple of other things. Her doctor told her, "Oh, women gain weight in this area in middle age," and dismissed her concern. Turns out she was riddled with cancer all through her abdomen that was only found when she went to the emergency room complaining of tummy pain and being unable to hold food down. She had a surgery, but she passed a year later. Story 76. Not a doctor, but posting on behalf of the pulmonologist who saved my life. Right before the pandemic really kicked off, I was taken to the ER because I couldn't catch my breath. My chest was hurting and my lungs felt like they were on fire. Went through the basic tests. Doctor says it's probably pneumonia and sent me home. I'm back a week later because my situation has deteriorated rapidly. I'm put on fluids, antibiotics. Same doctor says it's just pneumonia, but I get admitted for a week. There's 0 improvement. 2 weeks, nothing. 3 weeks, and by this point, I've had multiple chest x-rays, MRIs, CT scans. Someone points out my lung looks a little weird. Doctor is strangely resistant at first, but finally orders a biopsy because a pulmonologist asked for it. Instead of waiting for the results to come back, a surgeon is brought in, and they're going to remove my whole left lung. Because reasons. By that point, I could barely speak, hold a pen, comprehend what was happening to me. We're at the end of week 4, and when I went under for surgery, I destabilized so quickly that the surgeon was like, "Yeah, no, I'm never attempting this again on this patient." I spent a week in the ICU on a ventilator. Out of pure stubbornness, I got off the ventilator and was eventually returned to my room, approaching 6 whole weeks in the hospital. I have asked several times, "Do you think this could be cancer?" and was reassured, "Oh no, absolutely not." At some point during all this, a different pulmonologist was like, "There is definitely something ducky with this lung," and outsourced my neglected biopsy and some cultures to a university in another state. The day I was to be discharged by the admitting doctor with, "It's still probably pneumonia, we don't know. Here's a PICC line and some antibiotics," that pulmonologist came into my room. just sort of sighed sadly at me and told me I was pass of stage 4 lymphoma that had spread to my lungs. If he hadn't trusted his gut instinct, I would be pass. Instead, I'm 4 months in remission. Story 77. Fell down the stairs due to ice and essentially hit every step on the way down with my lower back. Ended up going to the doctor a little while later because the pain didn't go away, and he ended up saying I was bruised and gave me 1,000 milligrams ibuprofen. A year later, I went back to that doctor because the pain got worse, and I had to start walking with a cane because my legs started hurting a lot too. After a referral for an MRI, found out I had 3 herniated discs in my lower back. Got a surgery done about 3 months later, still needed the cane, but the pain was more manageable. 2 years later, I started to work for a particular nationwide secondhand store and ended up back at the doctor because even walking through a grocery store was unbearably painful. Guy thought I was an addict. Went to another doctor, and for almost 3 years, he would only help me with my blood pressure and nothing else. Finally, when the company I was working for was shutting down, I finally found a doctor who helped me push through everything and got another back surgery for the now 4 herniated discs while my insurance was still active. I no longer walk with a cane and have been mostly pain-free for 2 years. Story 78. I have a story in the opposite direction. A woman came into the ED for extreme fatigue and spontaneous bruising. They checked labs and saw low white blood cells, red cells, and platelets. They told her she has leukemia and will need chemo without actually doing any confirmatory tests. They admit her to my service. She is crying and screaming in fear, get more history, and find out she was just started on a medication for her rheumatoid arthritis that can cause decreased blood and platelet cell counts as a side effect. Did some further workup and found no evidence of leukemia, stopped the new medication, and within a week, she was completely back to normal. Story 79. I've always thought I was allergic to nuts, but over the years, I'd been able to grow out of it mostly. I could eat cashews and hazelnuts primarily and knew that I was allergic to peanuts, but I was curious as to how allergic to peanuts and any other nuts, Brazil, walnuts, pecans, etc., as it meant I was missing out on a lot of healthier foods and snacks. Went to my doctor's for a blood allergy test. First red flag was that it took weeks, 8+, to get my blood work back. Blood work finally comes back and surgery ring me to say, hey, good news, you're all good. Nothing shows you're actually allergic to nuts, even peanuts. This was somewhat a load off my mind, but I was a little bit suspect. I'd gone my entire life staying away from peanuts in particular and wasn't going to stop now, even though I apparently had the all clear, just to be safe. So I started trying different nuts and no reaction. Foods with almonds. Walnuts, pecans were all fine. Great, I thought. So my partner and I decided to go to Vietnam on a trip that year, and during research I see they cool a lot with peanuts, and by this time I've moved house. I want to be safe, mainly for my partner's peace of mind, and go to the GP and say, hey, just want to be safe, is there any chance I'd need an EpiPen? He prescribes one to appease my paranoia and says he'll look into my blood work on file for my previous surgery. Long story short, I get a slightly panicked call from my new GP a week later saying, your previous doctor really ducked up. You're deathly allergic to peanuts, and I'm going to prescribe you 2 more EpiPens just to be safe. But yeah, do not eat peanuts. Note, I'd had scares with peanuts twice in life through eating them once accidentally and the other stupidly, so knew the effects, but was never sure if I'd grow out of it like I seemingly had with other nuts. I was allergic to everything as a child, and through exposure and eating small bits of things, I managed to grow out of all my other allergies. Story 80. I'm an optometrist. I took over a 76-year-old odds rural practice. He was unconditionally loved by all his patients, and I think they all hated me because I spent the first 2 years of practice diagnosing eye diseases all too late. I used to refer 50% of my senior patients a day for surgery. Dozens of advanced glaucoma patients are untreated per month. I had to start them all on treatment years later than they should have been and then take their license. Of course, it was always my fault. It was a nightmare, going smooth now though. Doctors have read it. What is the biggest medical mystery you've solved? Story 1. I made something up on the spot that saved a guy's life. Motorcycle crash. Dude comes in agitated, breathing rapidly, has the I'm dying look in his eyes. We intubate him for low oxygen levels, and it's just not working. The tube's in the right place, but now he has 2 massive pneumothoraxes, collapsed lungs, and with every breath he is pouring air out of the chest tubes I placed. Air is going in, but not making it into his lungs. There's an airway injury somewhere, and it's big. I tell my ed colleagues to get a bronchoscope ready because we're going to do the fastest cut ever and figure out what's injured. He barely survives being in the CT scanner. We get one pass through and speed him back to the ed so we can figure out the next step. As the CT images come across, it's worst-case scenario. His trachea is completely severed, and forcing air to go through has created this large, air-filled gap in his neck meat between the 2 ends of his windpipe. Every breath we force in there takes the path of least resistance, meaning into the chest cavity and out the draining chest tubes, but not into his lungs. So basically, he won't survive long enough for us to try and surgically fix it. But if we could just push the breathing tube down to the lower segment, we would be able to help him breathe again. So, in a moment of inspiration, I tell my respiratory tech to set up the bronchoscope. I stick the scope in the breathing tube, like usual, and have the ed doc helping me pull the tube most of the way out. And there it was. Once the ET tube was pulled back, my bronchoscope was basically sitting in what felt like a giant cavern of neck meat, all stretched out from forcing so many breaths down the ET tube. And at the end of this cavern was the other end of his trachea. In reality, this cavern was probably 15 mm wide at the most, but I was locked on and drove that bronch straight down the middle and into the lower segment of his trachea. Once I had the scope in, I basically rammed it as far down into his lung as it would go, and the ed doc rammed the breathing tube over the bronch, down into the lower segment. His oxygen was back at 100% within 45 seconds. We got him up to the OR, and about 6 hours later, had fixed him up, and he survived that night. The best feeling, though, is when a renowned otolaryngologist, whom we called in to help with the tracheal repair, asked how I got the tube down into the lower part of the trachea. I described what we had done in the ED, and he just goes, "How? That's not a thing." Unfortunately, the story doesn't have a storybook ending. Without disclosing too much, the trauma to his neck also caused injuries to the carotid arteries on both sides, which caused blood clots to form in the arteries, which then broke off and showered into his brain over the next few days, giving him a whole bunch of small to medium strokes. Not completely brain dead, but enough that he'd never really recover neurologically, and if he ever woke up, he would probably end up bedbound for life. His family decided that wouldn't be acceptable quality of life and opted with withdrawal life support. Story 2. Not my story, but an ear physician, Dr. Mark Wahba in Saskatchewan, who recognized that the patient's headaches were due to carbon monoxide poisoning. And because the patient lived in an apartment complex, he also made some calls and was able to save the entire building from carbon monoxide poisoning. Story 3. Not a huge mystery, but one that drove me nuts for 4 years as a dentist was this guy who had severe acid erosion on all his teeth. But one area in particular was super bad. I figured he had to be obsessively eating something acidic and chewing it with one side of his mouth. I would interrogate him at every single visit, and there were tons of visits because he was totally destroying his teeth, to figure out what the hell was causing it. I probably asked the guy 50 times over 4 years if he liked to eat sour candy. Always said, not really. One day we had a long appointment together, and I just decided to name every sour candy I could think of while I worked. Captive audience. When I said crybabies, he was like, I like those, they're so sour. Come to find out he was eating 2 bags a day. Dude, what did you think I was asking about when I asked if you like to eat sour candy all of these years? Story 4. A cool call I had as a paramedic many years ago immediately annoyed my partner and I. 20-something-year-old male woke up with nausea and vomiting Sunday morning in a neighborhood that is known for young people partying. The call note said there was a small amount of blood in the vomit, so it got up. Triage to paramedics responding. We arrive and are met by the patient's girlfriend, who is freaked out but guides us to our patient, who is white as a sheet, drenched in sweat, vomiting all but pure red liquid into a trash can that is already pretty full of it. We start our assessment and treatment, and he has a vague medical history. He has always had digestive issues and has to eat a diet with extremely low fat. He has chronic diarrhea and really bad hemorrhoids. We ask about what he got up to last night and if he was partying. He says, no, he can't have more than a beer under any circumstances, or he's a mess for days on end. He smoked a little, but not more than usual. And he smoked from the same bag earlier and was fine. He has never thrown up before. He'd never done more than go to an urgent care for his issues before, as he didn't have insurance. Obviously, he has an upper bleed, but something clicked in my caveman brain and realized exactly what was happening. His liver was screaming for help. Can't digest fat, can't process alcohol. And what seemed like an innocuous comment was the key to the whole thing. His hemorrhoids. If the circulation through your liver gets backed up, it causes pressure in the blood vessels that come in and out to build up. If enough pressure builds up, the veins in your butthole balloon out, causing a hemorrhoid. If that pressure goes north, you can get esophageal varices, which are essentially the same thing as hemorrhoids, but in your throat. Despite our efforts, he had lost a ton of blood and rapidly got worse. Upon arrival into the critical section of the ER, he painted one of their walls, passed out, and needed to be intubated and given many blood transfusions. The attending, head doc in the ER, had always been an aloof idiot who didn't play well with nurses nor EM. But after the dude's liver labs came back and we were back later in the day with another patient, he pulled me aside to be like, what exactly is the scope of your guys' training? That was crazy that you caught that. I reflected on that moment for the rest of my career, during which I felt like an absolute git about 90% of the time. Story 5. Working out that someone's occasionally coughing up red liquid was linked to their menstrual cycle, then finding it was from a patch of endometriosis in the lung. Don't see that every day. Story 6. Shout out to the doctor who recognized that my toddler had leukemia. She had an ear infection with a low-grade fever that her PCP had treated with antibiotics. A week later, we took her to urgent care because she still had the fever whenever Tylenol wore off. The infection was gone, but she had been developing a lot of bruises in the weeks prior. Her PCP had dismissed the bruising when I asked if it was something to worry about. Some kids just bruise a lot, but the doctor at urgent care noticed she had bruises on her back and sent us straight to the ER for a CBC. We are 9 months into treatment and doing quite well now, thanks to her. Story 7. Not a doctor, but when I was working in ed as a nurse, I got a transfer from a smaller community hospital in our system. Guy was one of our cancer patients and had presented there with chest pain. And since their workup was negative, they sent him over thinking it must be treatment-related. So I go in and start my assessment, open up his gown to do a 12 lead, and I'm like, sir, how long have you had this rash? I scoured the notes he was sent over with, and there was absolutely no mention of a rash, even though they did an EKG there as well. I found the Ed MD, who was a notorious hard ass, super unfriendly, and asked if he'd seen the patient yet, which he hadn't, and I told him, well, I think he's got shingles. He went in, checked him out, wrote a script, and off he went. Story 8, not a doctor, but a nurse. I had a patient that had been struggling to find a medication to help with her anxiety and depression. After a couple of years of trial and error, we found a med and dosage that worked extremely well for her. Time goes by, and she suddenly starts having symptoms again. She said, I don't know what's happened. The meds were working so well, and now I feel just as bad as I did before I started medication. We spent several calls and visits going over every single thing, just grasping at straws. Has your pill manufacturer changed? Do the pills look different? Has your diet changed? Increased stress? Exercising more? Anything? Finally, I asked her if she had recently started any new medications prescribed by another practice, and she suddenly remembers, I started metformin about 6 weeks ago. I think to myself, that's it. I asked her, not to be gross, but are you having a lot of diarrhea since you started the metformin? She goes, yes, I'm pooping several times a day. I can't keep anything in. I then explained to her that the problem was, she wasn't absorbing her depression meds, she was pooping them out. So not only was she not getting the benefit from the meds, she had been going through med withdrawals too. She talked to the doctor who started her on the metformin, and he switched her to metformin air and changed the timing of when she took both meds. 2 months later, she was back to feeling good again. Story 9. My kid was born with a rare lung disorder called congenital lobar emphysema. At the time, less than 50 cases had been seen in the world. Son shouldn't have lived past 2 weeks, but our pediatrician finally diagnosed it at age 5 months. Son had surgery the following year. Our pediatrician was at a huge conference with around 700 mins in attendance, and the speaker threw out the symptoms for my kid's disorder. Only 3 hands in the room raised to acknowledge they knew the diagnosis, and one was our pediatrician. Story 10. I'm a medical librarian. I had a surgeon call me about a patient she was completely stumped over. He'd had a device installed, but it needed to be replaced. The problem was the location. If she tried to remove it, he would have hemorrhaged. If she left it in place, he would have passed slowly. Did a bunch of research, even called the device maker, and spoke to them. Finally found a tiny bit of a thread online, which eventually led to a YouTube video of the exact procedure she needed, and she was able to remove the device successfully. Story 11. I am not a doctor, but one saved my life by a simple handshake. I was in hospital with gallstones. I was prepared for surgery, saw my surgical team, etc. All good, we are taking you up for surgery. I felt absolutely rubbish, but put it down to anxiety and the pain from the gallstone. The doctor was in the room to see the woman next to me. He was Irish, and I'm Irish both outside Ireland, so we picked up on the accent and had a little chat, as you do. As he was leaving, he went to shake my hand. He walked away and came back, questioning me that my hand was extremely sweaty. I explained that I have anxiety and it was going off, but he was not convinced. Thanks to him putting up an argument that my surgery should not go ahead and I need scans. My scan was canceled 3 times, but he kept on pushing it through. I was diagnosed with multiple bilateral PAs. Story 12. Psychiatrist here. In residency, I was moonlighting at a standalone psycher. A man who didn't speak English was brought in by emergency services for psychosis. With some interpreter help, we were able to identify he was from Bhutan and that he had been a freedom fighter. But the interpreter said that he spoke very little that was comprehensible. I noticed some tattoos that seemed amateur and possibly from his time in combat. It dawned on me he could have hepatic encephalopathy from Hep C. I arranged transfer to a medicaler. They were pretty upset with me about it. To their credit, they called back later that night to confirm I was correct, leading to a plan of appropriate medical care instead of inappropriate psychiatric care. Story 13. Diagnosed lupus cerebritis in a patient who was basically comatose after being on ECT for depression. I think she still had some underlying psych issues, but improved significantly after starting high-dose steroids. I was consulted as a resident on the ID service and noted the patient had persistent proteinuria and had been seen repeatedly for joint pains. My attending said we should sign off after the lumbar puncture was negative for infection. but I convinced him to let me order lupus labs before we signed off. Story 14. Had a patient that was getting weird ulcers and was diagnosed with atypical Behçet syndrome. I realized that the ulcers were from the levamisole that was used as cutting agent in the substance. She quit the substance, and the ulcers went away. She also gained about 100 pounds and became diabetic, so, Story 15. Not me, but my attending. We had an older guy with new severe hip pain, but his x-ray and MRI was normal. Things were just off, and she felt like there was more going on. We got an MRI of his spine in low, and behold, he had a huge honking spinal abscess. Most of the time, you would expect to see weakness or sensory changes with a spinal abscess. He had none of that. We imaged his whole spine and found a couple more spots of infection. So we imaged his brain. Big old abscess. We also got a heart ultrasound, echo, that ended up showing a massive infection sitting on one of his heart valves. He had literally zero symptoms except this sudden onset hip pain. Long story short, we think his bad diverticulitis let some bacteria into his blood, and he was unlucky enough to have it seed his heart valve. He ended up doing great with a truckload of antibiotics. Story 16. Not really much of a medical mystery, but many cases of endometriosis that went undiagnosed for years. I also was able to figure out that a patient's dropping hemoglobin was being caused by scurvy due to his multiple-year-long commitment to a strict ketogenic diet. Story 17. I'm giving myself away with this, shouting out my former pulmonologist who solved my medical case, at least enough that I know the why now. I suffer from recurrent spontaneous pneumothorax. I've had 10 confirmed collapses in about 7 years, but against all statistical odds, only on my left lung. I'm a woman, 37 years old, started when I was 30. I am rail thin, but only $5 for. All this to say, I do not fit the criteria for who this condition impacts. I was tested for every connective tissue disorder that could be remotely related, as I do have other signs that might suggest one. But alas, all negative, even after repeat testing. I had already had a mechanical pleurodesis by the time he was my pulmo. When I needed another pleurodesis, he was part of my team and got my records and told me what my previous surgeon could have but never did. Apparently, the little sacs in my left lung are deformed in an almost diamond shape, making them prone to tearing. The odd thing, though, is that my right lung is more elongated oval and not diamond, so it hasn't torn and probably won't. I'm probably explaining this poorly. He also recognized I had untreated asthma my whole life and told me the scarring from my repeat collapses had given me COPD. He got me on meds for both. I've only had one minor collapse, not even a tube needed, these last 2 years since he cared enough to figure out the reason, instead of throw his hands up like literally so many other doctors did the 5 years before I found him. And then he left the practice super suddenly earlier this year, and I'm heartbroken because I don't know I'll trust another doctor with my life more. Damn it, Dr. P. If you ever come across this, thank you. Because of you, I was able to work again. Because of you, I got to enjoy physical activities with my kids again. My family and I never got to truly thank you for how much you did for me, maybe without even realizing it. I can breathe again, Dr. P. I don't think you'll ever know the hugely positive impact you made on my life by just caring, and I really wish I got to tell you that. If you read this, hey doc, miss ya. Story 18. Nad but saw this. Patient came with constant hiccuping that wouldn't go away and dizziness spells. Initially, they were told it was just hiccups and should go away, but it didn't, and it was constant. Their primary care and urgent care physicians kind of blew them off and racked it up to nothing. They wound up going to the emergency room, who did a chest x-ray to rule out some kind of weird origin. So anyways, this patient had a permanent pacemaker placed some months ago. Chest x-ray showed the wire that goes into the heart to pace them had hit the heart, gone outside of it, and looped its way around to the other side and was sitting partially against the vagus nerve. Their constant hiccups were from their dislodged pacemaker, causing pulsations to the nerve that controls their heart rate and breathing. They wound up having the troubled lead, wire removed and replaced, and their hiccups and dizziness were fixed. Story 19. Not a doctor, but giving kudos to my daughter's doctor. At age 5, she had a tummy ache that seemed more than normal, so we took her to urgent care. They sent her home and thought it was a rough stomach bug. She wakes up the next morning and doesn't want to move. From the time I could feel her kick until she came out, she was constantly on the go, so we took her to ER. Doctor tested her on heel drop tests suspecting appendicitis, but she passed. So he said he wanted to run a blood test because he had suspicion but was unusual. Blood test comes back. Her pancreatic enzymes, I think, were off the charts, which is what doctor had suspected, pancreatitis. She spent 5 days in one of the best children's hospitals in Colorado, no underlying cause, which is extremely rare for a child. 10 cases per 100,000 children, and made a full recovery. How that doctor suspected it, I have no clue, but very grateful for. On a side note, She was transferred to the Children's Hospital main campus, which is also a teaching hospital, and it was fascinating to see the process. Because it was such an unusual case, we had anywhere from 5 residents come in each morning learning about her, asking the head doctor questions, etc. Our last day, the department head came in to talk to us about how unusual her case was, that we would likely never find a cause and how difficult that may be going forward, but such is life. She's now 12 going on 18 as it seems, and hasn't had a problem since. Story 20. Not sure if this is a mystery, but I connected the dots as a resident 8-year-old kid that presents to ER with fever, sob, and a small lower leg wound after falling while running 2 days before. He also wasn't wanting to walk much due to pain from his leg. Everyone had assumed his wound, but when forced to ambulate, he had a bad limp. I was in last year of MedPed's residence. I presented the patient as fever from a septic hip 2 from his leg wound, shortness of breath and fever from pulmonary embolism also. This was my guess before labs and CT based on physical exam. In the end, I was right about everything. I was just trying to be a smartass. Because I had a good relationship with the attending in P in kids is way less common than adults. So I thought I would be more obnoxious throwing in the P part. It was humbling because I was just being obnoxious. And it made me think about what I've missed before not turning over rocks. Similar situation years later with an elderly woman with anemia. Aortic stenosis that my partner ran by me. She had been scoped by Guy and been to heme with negative anemia workup. Cards didn't think she warranted valve replacement. Patient kept getting passed, and my partner was getting frustrated. Being his ass, I asked if anyone had considered Haida syndrome. I told him put that in your note and send her back to cards. She underwent valve replacement. Story 21. Not a doctor, but I diagnosed a coworker's epilepsy once. We worked at a restaurant, and she was notorious for being insanely clumsy and tripping, nearly falling at least 5 times a shift. I don't remember what raised my suspicion, but I asked her what she felt whenever she fell. She said it was like everything would just go white for a second and she'd lose any control of her body, but didn't think it was serious because it only lasted a second. I told her those sounded like seizures, and though I didn't know the technical name, I knew not all seizures were the big ones like you see on TV and in movies. I convinced her to at least ask her doctor about it, if only for my peace of mind. A week later, I got a huge hug and a gift basket with her telling me I was bang on the money. And according to the doctor, they'd just managed to catch it and start treatment before there was any permanent damage. This was years ago, but I'm still proud of that one. Story 22. I'm the patient here and I have a few rare diagnoses, but I'll tell you the one with the more interesting story. See if you can guess the diagnosis before the end. It's an atypical presentation. At around 19, I began getting a lot of UTIs. Months later, I realized that I can't feel when my bladder is full. I go to a urogynecologist and do urodynamics testing that confirms the nerves to my bladder are indeed dead. I have a slight herniated disc, so it gets attributed to that. I develop really bad sciatica and my feet would go numb. I wind up in pain every day with significant muscle spasms in my lower back and down my legs, which is typical for a herniated disc. One neurosurgeon wanted to operate, but when I got a second opinion, he explained that my herniation shouldn't be causing these symptoms because it's very slight. I get referred to PT, but PT seems to worsen my symptoms. They told me they could no longer help me and discharge me as a patient. Years go by. My pain and numbness only worsen. Finally, the pain spreads to my abdomen and reaches a point where I am bedbound almost all of the time. I just so happened to be seeing a reproductive endocrinologist for fertility issues at the time, and they just so happened to have one of the best endometriosis specialists on the East Coast on staff. She recommended a laparoscopy on a hunch, and she was right. We operate, and there was scar tissue everywhere. I wake up with no more sciatica or muscle spasms. That surgery completely changed my life. I had never had bad periods. I barely even cramped. I had sciatic endometriosis primarily. And if I wasn't seeing that exact reproductive endocrinologist, I may never have had it treated. Story 23. Not the doc, but I was taking care of a patient that was hospitalized for multiple days because of crazy swings in her blood glucose. The docs couldn't figure out why 1 minute she'd be cruising well over 350 and climbing, and 20 minutes later, it would crash into the 40 AS. She was nothing by mouth for reasons I don't recall, possibly a gastroinfection, so we were pumping IV dextrose multiple times a shift to keep her alive. We were literally down to our last vial, including robbing the crash cart on my unit in the air, and I was freaking out because I was working alone that night. It was a rinky-dink rural outpost hospital. One doc in the ER on call is needed for my unit overnight, no real support besides calling him to transport to a larger hospital over an hour away, and I was afraid of losing my patient. In between this patient's crises and other patient care, I did a deep dive on the interwebs and found a research paper that discussed how some diabetics respond that way to certain classes of antibiotics. I let the hospitalist know in the AM and provided the link to the paper, but never got a response. I was off the next night and the patient was gone when I came back for my next shift. I was afraid she'd pass. but was informed by the outgoing shift that she discharged home because our hospitalist figured out it was the antibiotic causing the chaos and switched meds. And immediately, her blood glucose stabilized, and with the new antibiotic, the infection was brought under control. Story 24. Not a doctor, but an EMT. I was called to the scene of a car accident. A man had crashed into a fence near a reservoir. He had vomited down the front of his shirt and had a large red mark on his forehead. The police were ready to arrest him for DUI and asked me to check him out. I asked him what had happened. He said he was on his way to pick up his son from school when an animal ran in front of him, causing him to swerve, hit a puddle, and skid into the fence. As he spoke, I could smell what seemed like alcohol on his breath. It was also around 7 p.m. on a sunny Sunday in July. There wasn't a puddle in sight, and there were no skid marks. His story didn't add up. I asked how much he had had to drink that day. He insisted he hadn't been drinking. I pressed a little, and he said, "I do not touch alcohol." I noticed he was very broad-shouldered and about 6 feet 3 inches. I asked how much he weighed. He said 375 pounds. Then I asked if he was diabetic. He said no. Had he ever been tested? No. That's when it clicked. The alcohol smell wasn't alcohol at all. It was the fruity call sign of diabetic ketoacidosis. My patient was an undiagnosed diabetic who had likely passed out behind the wheel. That explained the crash and the breath. But what about the vomiting and bizarre story? While I was puzzling that out, the man asked to go to a small local hospital. Normally a reasonable request unless I have a trauma patient. I looked at the red mark on his forehead and decided to check his pupils. And that's when alarms went off. With help from the police, we loaded him into the ambulance and expedited transport to the nearest trauma center. En route, he complained of severe head pain, said he could feel his pulse pounding in his head, and then started screaming. His blood pressure was climbing dangerously higher and higher every time I checked it. When we arrived, the triage nurse tried to send him to general triage. I insisted he needed an immediate head suit. She pushed back. I grabbed a doctor, explained the situation, and he ordered a rush CAT. As I suspected, the patient had a brain bleed. He went straight from CT into emergency surgery to stop the bleeding. It's probably the call I'm most proud of. If I had done one thing differently, if the police had arrested him, if I'd taken him to the wrong hospital, if I hadn't argued for priority treatment, or if I hadn't taken the time to really talk to him, his chances would have been so much worse. He might not have survived. Story 25. Patient seen 5 or 6 times in our office, as well as her obgyn for swelling, pain, redness with workup for the typical culprits like yeast, BV, seeds, trish, etc. All negative and no response to empiric treatment. Spent about 20 minutes going through her whole history, including new underwear, brands of panty liners, detergents, douching, etc. Finally managed to figure out that she started using scented toilet paper, and all of her issues resolved as soon as she stopped. Story 26. Not the biggest medical mystery I've solved, but the first. I once had a 5-year-old kid come into an urgent care I was moonlighting in for cold symptoms. We talked about upper respiratory infections, supportive care, etc. Examined the kid, was about to leave when I noticed one nostril was putting out purulent drainage and the other was clear. I asked Mom about it, and she told me that nostril always drained. She was told it was allergies. You don't get allergies in just one nostril. I also noticed that the room smelled foul. This happens a lot, so it was not that remarkable, however. It was particularly bad in this case. Any physician reading already knows what this is, I bet. So I got a little bulb syringe and suctioned out as much as I could. Saw something in there. Couldn't really tell with all the mucus, but grabbed some alligator forceps and reached in. Pulled out a 3-inch chunk of wood. Mom was all amped up and emotional, started crying. Apparently he had this problem for a few years. Saw multiple doctors and no one had fixed his problem. And because of the smell from the festering foreign body, he had been relentlessly made fun of at school. It was such a small thing for me, 15 minutes extra. The other case is not mine. It was a story a.m. physician told me when I was a medical student. Had an obese woman come in with chest pain, they did all the tests and nothing came back. Finally, someone worked up the courage to do a PANIS exam under the fat pad. And this person had a wrapped McDonald's hamburger stuck up in the fat roll on her chest, and it had made a terrible dermatitis and pain. Another interesting kid with autism, severe food restrictions, came in with gums and tons of constitutional symptoms, turned out to be scurvy. That was when I was a resident. Since then, I've come to find this is not so uncommon, but it sure got me excited at the time.